of the second day of Ictahs conference. We have an array of speakers with us today. In the main arena itself, we are having 7 talks, 7 scientific deliberations. So I urge you people to please see and take the most advantage of all the talks. Please see to it whichever topics is according to you. We are running in the parallel halls as well. We are having 5 places where the talks are running. One is the main arena, and there are 4 gallery halls in the opposite building in the COPS. So please look at the program schedule. Whatever is as per your knowledge domain or interest, you please see where you belong to and go and participate in that particular talk. So in this main arena, we are going to have 7 sessions, 6 in the morning and 1 in the afternoon, followed by valedictory. So I request everybody who is standing back to be seated. Please take your seats. Let's maintain a scientific decorum over here. All the participants, please take your seats a little faster. Okay, so to begin the first session of the second day of this conference, we have among us Dr. S.J. Nalini, who is the Professor and Principal, Faculty of Nursing, Sri Ramchandra Institute of Higher Education and Research, Chennai. So I welcome ma'am, and this session will be chaired by Dr. Jacinta R. Mariappa, who is the Principal, New Royal College of Nursing, East Point Group of Institutions, Bangalore. Welcome you ma'am, and I request you to please come and take your chair on the dais. So this is Dr. Jacinta R. Mariappa who will be chairing the session. Welcome you, ma'am, to the conference. And I request you to please introduce the speaker of this session.
Hello. A very good morning to one and all gathered here, the luminaries. I'm honored today to be the chairperson for this session, which is dealt by Dr. Nalini. Dr. S.J. Nalini is a renowned figure in the field of nursing sciences. Madam brings over 30 years of extensive experience spanning the clinical nursing, education, research, and leadership points. She has presented more than 194 papers, published about 71 research articles, and authored 2 books in nursing. Her collaborative research on the terminal suffering among hospitalized South Asians, earned 3 bursary traveler grant awards from the Palliative Care Congress in the UK. She is on the editorial boards of the Journal of the Advanced Nursing and the Journal of Clinical Nursing, UK. She was nominated by the Governor of Tamil Nadu to the Executive Committee of St. John's Ambulance Association and as chief expert for preparing a common transcript for undergraduate nursing programs in the state. In 2024, she was honored with the SRIHER Mentoring the Excellence Award, highlighting her contributions to the nursing mentorship and curriculum reform. It's a honor and pride for us today to have such an eminent personality amongst us. Welcome you, madam, and we are very delighted to learn from you about the advanced nursing practices which make use of simulation and other equipments in the field of nursing sciences.
Thank you, Dr. Desanza. A warm good morning to one and all. I bring the warm greetings from Sri Ramchandra Institute of Higher Education and Research to one and all, and my deep appreciation to the organizers of this great international conference, ICTHS 2025, which is nice to, it's nice to know about 1,400 delegates who have gathered here to learn about the transformation and translation and use of technology in the healthcare professionals. So it's very important as teachers of today, we have to be so different in taking care of the younger generation. So I can't be a teacher like how my teacher was and how he taught to me. So I have to be different because education is not just learning about facts, but training the mind to think. So these are the words which has been proposed by Albert Einstein, and we have to change to meet the needs and demands of the Gen Z, who we face every day, who are more sensitive, they are interactive, they are tech savvy. So a teacher of today has to meet this challenge to create innovative aspects or methodologies in education. And this is what we call it as a curriculum revolution that is happening. We have moved from traditional to a revolutionized curriculum where we have introduced lots of newer pedagogies so that there is what you call it as preparing a nurse who is able to think like a nurse. So you are a professional and you need to have something called as critical thinking capabilities, and the pedagogies that we offer to them should infuse the concept of lifelong learning in a student so that you are able to prepare a better professional who is ready to meet the demands of the future. So with this concept, I move to today's discussion on advancing nursing practice through simulation and technology, which is in fact empowering educators to transform learning. So these are the objectives for the day. So what is this simulation? It is nothing but a series of events or activities that is either potential or actual that is happening in everyday practice, either in education or in the clinical practice settings in our field. Now these activities gradually helps a student to develop the knowledge, skills and attitude. Not only development, it helps them to analyze, and they are able to respond to the realistic situations that is happening in that simulated environment, or what you call it as created environment. So what is more important, as I told you before, we as educators are supposed to create opportunities for the learners. Now how do we create those opportunities? It's more important that we try to keep our students engaged so that in the learning methodologies, they are not just participants, they should be participants but not observers. The next thing is, whatever we offer should be motivating them, and it should give them opportunity to have a situational flow through which they are able to get a feedback what they are doing is correct or not. And then we should be able to create situation that helps them to meet the learning competencies or the set learning outcomes. And then, most important, every student should feel empowered in the way we give methodologies, because it should not make him think we're just doing something, but it should be something real learning that happens with every aspect or event that we provide in the curriculum system in our colleges. So this is what Edgar Cone of experience has actually taught us. Now Edgar tells that whatever methods and media that we use, it varies. The impact what it gives varies. So certain things which helps us to only read and write actually gives only 10 to 20% of learning experiences or activities that it is proposed to meet. Whereas certain activities like simulation will help you to achieve 90% of the students' expectations, and their learning needs and requirements is met with whatever you offer through activities like simulation. So, simulation and technology, how does it help nursing education? The first thing, a student is able to practice number of times in this risk-free environment. He is able to come across in the future real world, and he can make so many errors. There's no problem at all. Now you make errors, tomorrow you should not make errors. That is what is very important with this practice of simulation. There's learner engagement that is taking place. The learner becomes so interactive. He becomes immersed with whatever is happening with the situation. And we provide a lot of safety. We are able to incorporate the evidence-based practices, and patient safety is taken care for the future. And the student is able to develop skills, competence, and you are able to prepare ready people for tomorrow. And most important, with this methodology, we are able to even contact those students who are in the remote arena and make them better practitioners for tomorrow. Now, there are different simulation modalities. It starts from the simple task trainers that we give, like an IV arm that we have, or a simple airway, or a centerline board that we always keep for the students, or a CPR mannequin or a torso which we keep for the students. And then we have human patient simulators like a full body mannequins that we give them. It can be either an adult or a baby or a newborn. And then we also have extended reality where we have incorporated virtual reality and augmented reality in the system. So we have highly emphasized technology that is incorporated in the system. And apart from that, we also have the standardized patients who act or role play the scenarios for us as taking up a particular character that has been given to them. And then we also have screen-based simulation where, especially you can see in anatomy and physiology classes, we are now having softwares to deliver the problem-based learning methodologies. And then we also have the hybrid where we try to incorporate, say, for example, a standardized patient along with a task trainer. So multiple aspects or modalities are possible, but the levels of fidelity do vary. So what is this fidelity? It is actually the degree of reality that we have in our simulator. So our simulators, what we use, can be a low-tech simulator or it can be a high-fidelity simulator. Now today the concept of fidelity is getting changed to either being low-tech or high-tech. So low-tech tries to give you more knowledge. You can practice as many number of times if you want. Like for example, the simple one what we use is a CPR torso, the human torso what we give for the students to practice, or an IV arm which we give for the students to practice to insert an IV line. A mid-fidelity simulator in fact is little more realistic compared to the low-tech ones, where you have a full body mannequin which really imitates the breathing sounds or the little bit the up and down movement of the chest is seen. And the high fidelity ones are in fact more authorized, more computerized in nature and can depict a scenario in a more realistic manner. So Miller's pyramid, Miller is a very famous psychologist who was actually dealing with cognitive psychologists, and he told us actually how we transform our knowledge. From the classroom teaching what we have, we gain knowledge, and then you go one step higher to understand what knowledge you had. You go in for developing your competence, and then when you get into the performance-based activities that you do, you go to the next level of showing things, and then in the real world, you are able to enact or create these activities, and that is what is very important, where we are supposed to provide our students with those increased level of simulation fidelities so that they are able to come up to that level of action when they become the true professionals for tomorrow. So here you can see that the skill acquisition goes across the period of years. So if we have a course across 4 years, we give lots of low fidelity in the initial learning, where we try to make them learn the basic or the generic learning skills, and then as they go on, we go in for higher learning methods or use high fidelity techniques, where a student is able to really think what she's supposed to do. For example, you have a postpartum hemorrhage that is happening, and how I am supposed to react as a nurse in a situation is something that we have to use high fidelity techniques, and this has to be taught with the higher levels of education as the student come across. It is not that we have to stick only to low or high in different levels, but whatever has been given to the student has to be perfectly utilized to achieve the set objectives. Now there are different types of fidelity that is there, which we are supposed to discuss a little bit here. Now there's what you call it as equipment fidelity, where the student should feel that he's using something which is more realistic, like the skin of the patient. How real it is, what you provide makes a lot of difference. And then comes the environment's fidelity. Even if you're going to have a high-tech simulator and you're just going to keep it in the corner of the classroom, it will not give that environment fidelity. It doesn't look like a ward or an ICU setting. So it is important to give that environment fidelity, where the student tries to put inside his mind and tries to create or keep his mind accept that I am inside a ward or I am inside a theater or an OT theater. The next important thing is psychological fidelity. Our students actually don't come forward and they are really frightened when they are supposed to do activities like simulation. So you have to keep them understand or make them understand that you are performing in a safe environment, and whatever you do will not go out of this room, and you can make errors. This is meant for making errors and learning, and that confidence has to be given to the learner. And most important, the scenarios what we prepare has to be so convincing, and it should be related to life activities that is happening in real world experiences. So that will make that concept for a student to understand what he is learning through simulation is something very, very important, which he carries along in his real world for the future. So these are some of the pictures. Actually, we had an opportunity to go in for a faculty exchange program last year in 2024, when we had an opportunity to be in the University of Hull. So there we got an experience of how Hull University in UK offers a lot of simulation based modalities for the students, starting from a simple CPR simulation to the advanced one. What you can see here, a complete operation theater setup that is there, ward setups. It can be a neonatal ward or an adult ICU ward. So every setup is provided, and we were so happy to learn this simulation environment is not available only in the university or the college. It is also available in the same manner in the hospitals. So what has been taught as simulation modalities is even carried, and it is being reinforced again and again for all the clinical professionals over there, so that it goes on. There is what you call it as learning that occurs continuously, and this is what is the experience we got in University of Hull. So it's more important to understand that this simulation helps us to bridge the theory and practice, and we are able to get the foundational knowledge, where we move on into the simulation based practice in the laboratory settings, and then we gain the clinical competence, so that we are able to really make decisions in the clinical settings. Now there are few key elements that we are supposed to have in a simulation based education. The first and foremost, we need to have teachers. The academic people are very, very important, and they should be people who train us in this simulation. and it's very nice and good to have actually people who are certified in this simulation technology and techniques, and it's better to have faculty trained in or certificate courses that are available. They can get trained in this use of this simulation. And then what is required is complete planning. You need to have the program scheduled. You should have planned how it has to go on, then implement and evaluate what is being given. And the last one is you need to have resources. The resources, you need to have the simulators, you need to have all the equipment, tools are required. So if all these are there, then effective learning is possible. So there are few best practices that is really happening in simulation that facilitates effective learning. First and foremost is the preparation that we give to the students. So we make the students to understand the clear objectives, and we make them understand what is the scenario, where it is taking place. A good pre-briefing is given which prepares the student to go in for this technique. And then we also create or emphasize on psychological safety, where we have a non-judgmental environment, and it is not a place to point out to the student what you do is utterly wrong. It's not like that we try to emphasize. We make it more convenient to have two-way communication, and that psychological safety definitely ensures a student to make it possible, and he has that confidence. Even if I make errors, it's not a big issue. Then followed by the enactment of the scenario, there's what you call it as debriefing that happens, where the students reflects on what has he done during the session, how he has actually performed during the scenario, and you get a constructive feedback. And most important, there's also self-assessment that is possible. What is that I have done, why I have done, and why I should not do, is something that he realizes, and this goes on to support the entire learning systems of the future. Now, what are those problems that we face when we are trying to incorporate this simulation-based learning? Most important is time factor, and we find our syllabus is too much loaded, and we have to really do need analysis, which are those areas which requires a simulation, and definitely we need resources. And we should always think that whatever simulation, what we give, is in fact a supplement, and it is never going to replace the clinical learning what the students get. So there should be a balance between what you offer in the clinical area and what you give in the simulated learning environment in your laboratories. And then whether we have always this confusion, should I go for the high fidelity or the low fidelity? That problem always occurs. And sometimes we find lack of consultation. Even if I want to ask somebody, I don't find an apt consultant person who can clear all my queries. And sometimes we have lots of problems in selecting the best of the simulation model, and though we give or offer simulation, how much we are trying to use them for feedback is a big question. So it's important that we try to get or gather a lot of feedback from all our stakeholders, which includes our students, faculty, and the staff. So we need to dispel certain myths which normally exist among academicians related to simulation. The first and foremost, we always think all the simulators are high-tech, and there is a lot of money that has to be pumped in order to buy the simulators. It is not so. There are lots of small low-tech simulators that are available, which you can give great amount of learning can be given. So it is in fact scalable. It moves from high to low, and you can use or improvise. Even the small low-tech simulators can be improvised in order to give the high-tech opportunities for your student. And then, as I said, it is more, the simulation is supplementing your learning. It is not a compensation for the clinical atmosphere or the clinical learning what we are going to provide for the students. And as much as possible, they should be what you call it as realistic scenarios that is being given for the student, and the student should feel the benefit when he's doing the simulation. It is something he has to feel that inclusivity in there, and it's important we have to use user-friendly technology. If these are being used, your simulation is going to be the best opportunity given to the students to learn. And there are lots of high fidelity. High fidelities are in fact something which mimics the real world scenarios, and they also give immersive experience for the students, where the students thinks that he is in a ward rather than in a classroom where he is standing, and it enables them to critically think and also gain technical knowledge with the skills, and he is able to take better decision making in a controlled setting. Now there are lots of ample opportunities that is growing today to integrate technology inside the simulation. So we can incorporate the learning management systems we have in our universities to in fact structure the courses or use the simulation and also go in for a progressive tracking. And we can use this upcoming virtual simulations that actually provide better learning opportunities for the students, and the skill, the number of times he can perform the same skill is better, and it is actually, he gets the feel of learning in a ward. And we can also use the electronic health records, which helps in maximum amount of correct documentation that is done by the student. And we can also use the telehealth modules by which the students are able to remotely connect with academicians and also enact the scenarios. And a lot of mobile learning apps are also available which helps the student to learn anytime, anywhere. So this sort of education is possible today, and remote mentoring is possible. So I remember when we had an opportunity to get trained in one of the state simulation activity that we had in Tamil Nadu. AVPRO Simulation Center was one of the area which we're trying to train our faculty and all the teachers across Tamil Nadu. So there they continued this follow-up by means of remote mentoring through this platform of remote mentoring, and we had a lot of sessions where what was happening in Ramchandra was visualized in AVPRO Simulation Center, and they were able to give us feedback. So it's going to be the future. The virtual and the remote simulation is going to build the bridges, and it is going to provide clinical experience. I still remember in the medical colleges we used to have cadaver, where students used to practice on a dead body. Today this concept has gone. So we don't know how it is going to be tomorrow. We have lots of students coming inside, and it's time we have to go in for virtual modalities of using this remote and virtual simulation to train our students. So with the immersive learning, we are moving in from the traditional learning model where students can replicate or practice number of times. You get what you call it as immersive practice, and it is safe practice setting, so the skill learning is much better, and you are able to make your students to think critically in rare scenarios, and you are able to produce nurses who are becoming ready in order to face the real life world of tomorrow and become competent also. So these are some of the immersive learning where VR is being used, where they have avatars being created, and it tries to move within the control setting in order to give you opportunity to practice. Now this is something which we did during the time of COVID, and that's the time we got connected to this virtual simulation where we tried to connect with Ladril India, and they were able to support with lot of virtual simulation opportunities for our students and our nurses and our faculty. So this was one of the scenario that we used where we taught them on how to do a CPR for a COVID patient using this virtual simulation technique. And you can, using this AI which is coming up and going big boom that is happening with the AI today, we can transform nursing with the use of it. AI will help us to take better decisions in the clinical area. It is going to help us with documentation, and it is also going to give us a predictive identification through its analytics by identifying which are those areas where the student is actually making a error or a risk, or which are those areas which we are supposed to improve, and we are able to adapt it for the student's need. And as each of our student is different, we can utilize AI which can take care of each of the students' needs. So every student is considered to be unique. So AI makes this possible to teach every student in a different manner, and simulation and virtual patients incorporated with AI is going to be the future, and we can do a lot of assessment and feedback. A real-time feedback is also possible with this system. So the Indian Nursing Council, in fact, has brought in a good simulation center. I think many of our faculties have undergone training in this National Reference Simulation Center that is situated near to New Delhi in a university called as SGT University. So they have trained, and it's important what training our faculty have got from these areas has to get transformed to all the other faculty members who are there in our colleges. And the latest thing that is picking up is interprofessional simulation education. Now we are all working in a scenario where it is always teamwork. So we don't work in silos as a nurse or a doctor or a physiotherapist. So we all have to work in a coordinating manner. For this aspect today, the interprofessional simulation is gaining its ground in our country. So it's time we have to incorporate this concept of interprofessional simulation, where you have students from different specialities enacting the scenario and they play their role. So instead of a nurse playing a doctor role, physiotherapist, it will become a nurse doing a nurse's role and a doctor doing a doctor's role. So that definitely helps each other to understand and also respect each other's boundaries of doing the professional activity. Now, what does literature tell us? What does research tell us is something that we have to understand also. So use of simulation in nursing education, they did a cross-sectional inter-university study which gave us information that though clinical simulation is something that is incorporated in the syllabus, you can see that there are variations across universities where the number of hours that is given for simulation varies. There are some universities, they just give about 24 hours, and there are universities that they can go up to even 516 hours. So there are variations. So this tells that whatever experiences given to the students are not the same across the various learning centers. But there is a lot of impact on the simulation training because the patient safety risks are reduced. The accidents or the incidents that are created related to the patient safety definitely reduces with the use of simulation. The learning satisfaction is very, very high with simulation, and skill acquisition also has improved to 85% post-simulation activities in a study that was done. Now, what is the effect of high fidelity? Now, high fidelity, they say, is something which really improves the students' ability to clinically judge a situation, and it also helps them to really recreate that real world scenario. So this is what the study has shown, that clinical judgment is much better and it is significantly high after using simulation with high fidelity mannequins. So what is the impact of the simulation based learning? So they have found out through this quasi-experimental study that was conducted among 177 students, and they found that students' competencies, skill competencies improved, the confidence levels were very high with the students, and they were able to perform better, and the satisfaction of the students also improved with this use of this methodology. So if we are supposed to have effective simulation integration in our curriculum, what is required? The first and foremost, we need to have a needs assessment that is being done. We need to train our faculty, which is very, very important. If we don't train our faculty, then it's no use having a big lab in our university or the college. And then we have to deliver all the simulation sessions. And in fact, I should be pointing out here, our Tamil Nadu Nurses and Midwives Council has now taken the next step, where they have also given the simulation training, and now we are in the process of preparing simulation scenarios that becomes commonly used for almost every college. So we are in the process of preparing this simulation scenarios, ready reckoners which can be utilized by faculty members. A lot of resources are required, and every college management should think about allocating the perfect resources, and we have to design curriculum in such a way ample amount of adequate hours has to be given for simulation training. And what's more important is getting the feedback, evaluating the use of the technique, which is definitely having a improvement and bringing out the competencies or not. So simulation is something which definitely helps us to rehearse as a team, especially the interprofessional simulation, and it helps to bring about the collaborative practice, and it builds the trust if you're going with your simulation. So how you can integrate the feedback? You can use standardized rubrics or a rating scale to judge the performance of the students when they are in a simulation experience. And you can also have a reflective journal where the student writes what he has actually experienced. Reflective journaling is very good, which helps them to critically analyze and think on what they have done. There are a lot of competency checklists also which you can use to identify whatever perfection they have achieved with the competency. And finally, you can customize to identify how much of the effect or the impact the learning experience the students were able to experience with your simulation. And then you can also, you can create individualized learning plans and progress with the feedbacks which you have obtained from your students. Now, there are few key barriers that we are supposed to address. One is a lot of constraints that will happen with the softwares. Faculty resistance is something that we face. Technical issues, and sometimes you have good simulators that is not being used because of the technical issues. Time constraints is something that is largely limiting us from using this technique to a greatest extent in our learning field. And maintaining learner engagement for a teacher is challenging with this system, and we need to have a lot of support from the administration, and we need to have ongoing faculty development programs. It is not that once I train my faculty, that's it, and you have to learn everything. It has to be ongoing, and we need to have a lot of pilot programs, and you need to create partnerships with people who have good institutions which have simulation arenas, and you can also send your students to those places to learn, and we have to have continuous evaluation and feedback. So these are certain simulation activities that we took up in Srihar. In fact, we brought in a simulation workshop which we organized at a national level conference along with the Lateral Medical India in 2020, where we trained all our faculties. And one of the papers which we produced from this, it went on, not only for, it went on to get published in BNJ Simulation and Technology. And this workshop created us to take up simulation activities in our college even before the incorporation of the syllabus by Indian Nursing Council. And this is the latest one. These are the pictures of the latest workshop that we conducted in collaboration with ASPI, an international organization, Association of Simulated Practice in Healthcare. So there was a workshop that we had for titled In Situ Simulation. So simulation, it's not meant that you need to have a lab or a separate space. You can even do it in your hospital. This is the concept we try to bring through this in situ simulation. And the other initiative, we had a big conference where we had more than 400 members joining us in this simulation activity with Association of Simulated Practice, along with the Tamil Nadu Nurses and Midwives Council, who partnered us to conduct this international healthcare simulation workshop just about few months back in our place in August 2025. And these are some of the pictures you see. And you can see one of my student, a scholar, PhD scholar, who's trying to do a virtual simulation using an innovative infection prevention control. So this is a virtual avatar that has been created, very useful both for the students and the staff nurses who are working in our hospitals to use this to make the environment more infection free. In fact, when I used it, I felt I was becoming like a small child playing the game. And if you are interested, you can scan this QR code and contact her for further, access to you as well as to your students and your nurses in the hospital. So these are some of the pictures that I have posted here, how we try to train. Being an obstetrician and gynecology nursing specialist, we do a lot of activities related to suturing. So I have my teacher who's sitting there, Dr. Urmila, who's going to become Dr. Urmila, now currently Miss Urmila. So she is training our students, even using the chicken breast to train the suturing. So this is how we used as much as possible the real concepts in our labs to train our students. So this is another initiative that Srihar has taken up, where we have introduced virtual reality, partnering with an agency called as Medicine. So our students are sensitized with virtual reality, and so many scenarios which is not possible in an everyday aspect in the hospital is now being offered through this virtual simulation. So as teachers, it's important that we become exceptional teachers who are able to inspire, and enthusiasm is something, the father of excellence, and I hope we will be utilizing this concept of simulation to the best of its nature to help our students to become ready for the future. Thanks for the opportunity once again. Thank you.
Thank you very much, Madam, for elaborating on the advanced nursing and simulation and throwing light on the simulation techniques. I just wanted to ask you, how far this simulation technique can be accredited and what is the role of our apex bodies?
Yeah, accreditation of simulation centers are now possible. Very recently with this workshop, what we had, the ASPE workshop, we understood that in India there are now 3 centers which are accredited. One is, I know very clearly, is Apollo Simulation Center, and then there was also D.Y. Patel which had its accreditation. So all of them, they made me understand that for getting this accreditation from an international agency like ASPE, it is not required that you should have an exotic high-tech facility lab. It is not required. What is required is you have to follow the standards, what has been set by them. So if you follow the standards, and you can use your low-tech and medium-tech simulators in order to get this accreditation. So it is not only ASPE. I know that there is something called as INACSL, that is international accrediting agency with US, which tries to give clinical simulation. I know Sultan Qaboos has got this simulation accreditation, and there is also in US something called a Society of Simulation. So whichever you want, you can write to them and you can get some support and help in order to accredit your labs. So that is one. And I learned from my scholar also yesterday that even individuals, even me, I can undergo the training and get certification from these agencies that I am a certified simulator who can train others, and I get an accreditation. So personal accreditation, person-based accreditation is also possible in simulation.
Madam, thank you so much. I would like to, highlight, request you to highlight for the present day generation, our students, as they have seen a transformation in every aspect of the health sciences. What would be the take-home message for this younger generation, specifically in handling the simulation techniques at the lab scenarios?
Yeah, I should really tell the students how important to get that practice in the simulated labs. Please understand and respect the time that your teachers have spent in creating scenarios for you, not only creating the hard work your management, the entire team of faculty are taking in order to make you learn through different methodologies. So respect the time and value their input that they have given. And most important, India needs nurses and good healthcare professionals. So it is not possible to give every practice opportunity in the hospital, and we are growing. The number of students who are coming to us are now expanding, and we have to understand that scenario, that we have to utilize those opportunities that are given in this simulation labs and use them to the best of ability. And most important, this labs, I feel, is something that should not be restricted to the time zones. It should be open for students to practice any time they want. So if we open up for them, I think they will definitely reciprocate, because students are always, we learn a lot from the students. So if we give them opportunities, they will definitely take up in a better manner.
Thank you, madam. Thank you so much for highlighting. And you have been a real eye-opener. You have culminated both the virtual reality with simulation, the real scenarios in a day-to-day life, what a student could experience in the clinical setting. And at the outside, I thank the organizers, the Dayanand Sagar University, for giving us the opportunity, for me, the opportunity to chair this session. And thank you very much, madam, for the elaborative session once again.
Thank you so much, ma'am. Nalini ma'am is asking any question from the audience if it is there. You can come up with it now, or if you want to meet her in person, I think she's available for some time. Okay. Okay. Thank you so much. Thank you, Jacinta ma'am, also for chairing the session. So, as a token of appreciation and thanks to both of you, I'd request our Dean, School of Health Sciences, Dr. Pushpa Sarkar, to kindly come up and present with a token of thanks to Dr. Nalini for her insightful talks on the simulation in nursing. Center stage, please. Thank you, ma'am. We would also like to extend our thanks to Dr. Jacinta for chairing the session. I request Dean ma'am to give a token of appreciation to Dr. Jacinta as well. Thank you, everyone. So to continue our session of the morning, we will have the next session of the day, which is by Dr. Valentine C. The title of the talk is From Evidence to Action, an Introduction to JBI and Systematic Reviews in Healthcare. To chair the session, I would like to call upon Dr. P. Senthil Selvam. He is a professor in HOD, School of Physiotherapy, Wells Institute of Science,